Hi, everybody. My name is Sage Lewis. I'm going to be your host today. And today I get the pleasure to be with Dr. Berkowitz. How are you, sir?
I am doing great. Thanks, Sage.
I'm so glad you're here. Doctor, tell us what your specialization is.
I am an orthopedic spine surgery that specializes in surgery of the neck and the back.
I am so excited to talk to you. This is a topic that's near and dear to many people's. This our spine is everything to us, especially when it hurts.
Yes, isn't that the truth? I mean, everything you do involves your spine. It's hard to shield yourself from using your spine.
Yeah. So, what are some of the most common reasons people come to see you?
So, neck and back pain, and also what we call radicular pain, which means pain shooting down your arm or shooting down your leg from a pinched nerve in either your neck or your back. Those are the most common reasons we see people.
So, you could have a pain in your arm or your leg, and it could be related to your spine.
Exactly right. In fact, oftentimes it is. When people say they have sciatica, that's a pinched nerve in your back. That's not a problem in your butt or your leg. That's a pinched nerve in your back. Some people have a similar symptom in the arm, and we call that a radiculopathy or radiculitis, but it's the same concept. There's a pinched nerve in your spine. The nerve that's pinched goes down that extremity, and you feel the symptoms down that extremity.
Wow. So, what is that sciatica? That's a nerve, right?
Yeah, so the sciatic nerve is a nerve that sort of is in your butt region that goes down your leg, but those nerves that make up the sciatic nerve all originate in your spine, and they sort of wind together like a rope and create the sciatic nerve. But they originate from your lumbar spine, and that's why the problem usually is coming from your back, giving you the pain going down your leg.
I've been to those traveling exhibits, the body exhibits where they show the body without skin and stuff, and they
Yeah.
oftentimes show these nerves. They're just spreading throughout our entire body from our spine. Is that right?
That is correct. Yeah. I mean, remember, we have a central nervous system starting with our brain, and everything is connected to that. Otherwise, we wouldn't be able to sense what the nerves are doing.
And is that how it's going? Is it going from our brain down through our spine and then out through the rest of our body?
Yeah, but lots of nerves branch off at different regions. We have cranial nerves that literally branch off of the brain directly and have functions, and we have nerves that branch off the spinal cord. And then as you get down below in the lumbar spine, we don't even have a spinal cord anymore. All we have are nerves down there that branch off and do have different functions with sensation and motor down into your legs.
So you're saying our spine just evolves or just transforms into just a bunch of nerves ultimately?
That is true. Right around the L1 level, have you heard of the lumbar spine before, which is the low back? Well, right around L1, on average, it's different in every person, but on average, our spinal cord ends, and we call that the conus, which is the end of the spinal cord. And then it creates a whole group of nerves called the cauda equina, which is Latin for horse's tail, because that's kind of what it looks like, a horse's tail. It's a bunch of nerves that are kind of in our spine, and they all branch off in different spots to do their job.
So do you then ultimately become an expert, a specialist in nerves then? Like,
A lot of what spine surgeons do is we make unhappy nerves happy. we unpinch them or reroute them or do things to make the nerves function more normally. But it's not just that simple, because sometimes the bones of the spine are shifted out of position and we need to straighten the spine or do other things as well. But yes, a lot of what we do, and probably I would say the majority of what we do, is work on the nerves of the spine.
is that oftentimes what the pain is the nerves, not so much the spine itself?
The short answer is yes. I can go into a little bit more detail. Typically, when patients have back pain or neck pain, we usually attribute that to some sort of arthritis or degenerative change or fracture of the spine itself. So the discs, the bones, the ligaments, the muscles, the tendons have some sort of problem somewhere in the neck, and that would give you neck or back pain. However, if we have a pinched nerve or a nerve that is compressed in some way, that typically gives you arm or leg pain. So it all really depends on what the pathology is and what we're trying to treat.
I've gotten to talk to some other doctors about, like, say, knee replacement, and they were talking to me about arthritis and how arthritis is just the deterioration of that padding almost. Is that very similar? Is there a similar type of thing in the spine?
It is similar, and I always joke with my patients, and I'll joke with you as well, that it's a lot more complicated than what I do. It's not a simple joint like a knee, like my dumb partners that just deal with one joint, you know. And I'm kidding, because my partners are brilliant and do an amazing job, but it is more complicated than that, because every level in the spine has two joints, a disc, and a bunch of ligaments and a bunch of muscles and tendons that are all involved at each level. So then below that, two more joints and a disc, below that, two more joints and a disc, below that. So it's not just one knee joint or one, hip joint, like the joint replacement partners we're talking about, but the process is similar. Yes.
You're saying at each level, there's two joints.
Yep. One on each side. That's what allows your spine to bend and move.
Wow.
And there's a disc between there, and that's the cushion that allows the motion between the bones.
There is a cushion. There is a disc.
Yep, and that's when you hear about people having disc problems. It's the disc or the cushion that's giving them their problems.
Do these discs, I've heard of this, a slipped disc. Is that a real thing?
It is, but they don't slip. That's the slang for a herniated disc. You've probably heard of that as well. Most people have. And a slipped disc and a herniated disc are the same thing, depending on how they're using that slang term slipped. There's another example where the bones of the spine, the vertebral bodies, can slip forward on each other. And that's called a spondylolisthesis. And some people even use the term a slip disc to mean that. But usually when people say slip disc, again, it's a slang term. They're talking about a herniated disc.
And what does that mean, a herniated disc?
So the discs are the cushions between the bones, and they allow for bone motion and allow for shock absorption. And, it's a very complex structure, the disc, but I like to make it in simple terms, explain to people that it's kind of like a jelly donut. It's in no way like a jelly donut, but I use the jelly donut as an example because everyone knows what a jelly donut, how that's formed. And there's an outside part, which in our discs in our body, we have a thick, really tough outside part. It's thick and tough like a tire almost. And then the inside part in a jelly donut is jelly substance, but in our disc, it's more like crab meat. And what happens is there's normally no.
You said crab meat? Okay.
Crab meat, exactly. That's more of the consistency. So it's like a tire filled with crab meat, and there's no holes in it. And sometimes, just like in a jelly donut, you get a hole in it and the jelly squirts out. Well, in our backs or necks, when that happens, the jelly isn't jelly, it's this crab meat type stuff, and that squirts out and it pushes on a nerve. And then if it's pushing on the nerve, like we just discussed previously, that would give you leg pain if it's in your back, or arm pain if it's in your neck. And it also may give you some neck pain when the disc herniates. It causes some pain in your neck or your back, depending where it herniates. So that's what a herniated disc is the inside material of the disc squeezes, sort of squirts out.
If it squeezes out, can you get more? Will your body make more of it? Or if it's out, it's out?
It's out, it's out. Yep. And so that disc starts to look degenerative, starts to look a little different color on MRIs, looks a little flatter on x-rays. And the more that comes out and the more fluid you lose, because there's also water in our discs, like there is in the knee cartilage. When that wears out, same thing. When that fluid and water content starts to decrease, the disc will start to collapse a little and will change color on the MRI, and it looks like it's wearing out.
How is the spine held together? Like how does it stay as a spine?
Yeah, that's a good question. There's a lot of structures that keep the spine in its normal shape, and we've all seen spines on even just t-shirts. People have a picture of a spine on a t-shirt. It's like an S shape, and the way it keeps, that's looking at it from the side. From the front, it's straight up and down, and the normal spine is shaped like that. And it's a variety of factors. The joints help. The discs help. There's ligaments all throughout the spine that hold it stable. And even to a certain degree, the muscles help as well. So that whole complex of, joints, ligaments, muscles, and the disc keep it straight. Again, if we're going to refer back to my orthopedic colleagues, for the knee, for example, the knee is held together in a very similar way. They just don't have a disc in the knee. They have meniscus, but they don't have a disc, but they have bones and ligaments and muscles that kind of keep things lined up straight. And that's the same way the spine works.
So I hear about, I have something at L1 or L2, right? And how many of those are there? Like,
most people have 5 lumbar vertebrae, and L stands for lumbar. That's the lowest part of your spine. The next level above is the thoracic part of your spine, and most people have 12 of those. And then the level above that is your cervical spine. So we call that the C spine. And there's usually 7 or so of those.
It seems like I hear more about those L levels. Is that where a lot of pain is happening for people? Is in this lower, or do you find it equally throughout the entire spine?
No, I would say the lumbar spine has the most issues because it bears the most amount of weight. Now, interestingly, the cervical spine has the second most issues because we have a lot of motion and there's a lot of force on our neck. And the thoracic spine has very little issues often because we have ribs that come off of our thoracic spine, and it's a very stable area. There's a lot less instability and a lot less chance for there to be trauma or damage to your thoracic spine because of the ribs and the function of the thoracic spine. So we see a lot less thoracic problems than we do lumbar and cervical.
Do you think we're going to do like joint replacement in spines like we do in knees and hips?
I already do disc replacements in the cervical spine. Was the first surgeon to ever do one at St. John Hospital and Elyria Hospital and on the west side here.
Wow.
That was back in, I forget now, 2009, I believe. And I do disc replacements in the neck on a somewhat regular basis, but it's not super common nationally yet. It's more of a field that is up and coming.
Holy cow. So I can't even imagine can you explain that in a super simple, how that works?
Sure. We make an incision in your neck. We take your breathing and swallowing tube and push it to the side gently. We come straight down. Believe it or not, the cervical spine is very close to the front of your neck. Most people think it's much, much closer than the back, but it's pretty close to the front. We come down to the spine. We take the disc completely out. Once that disc is out, we can see the spinal cord and the nerves that are branching off. So we unpinch those because usually we're going in there because there's a pinched nerve giving you pain going down your arm. So once we've accomplished that job of unpinching the spinal cord and the nerves, now we have a space where the disc used to be that is now completely removed. We completely took that disc out. And then we put an artificial disc in there. It's just like a knee replacement. There's a piece of metal, a plastic in between, and another piece of metal, and that allows for translation, rotation, and bending of that segment, just like your disc normally works.
So complete mobility.
Well, the typical disc gives you about 10 degrees of flexion and extension motion, and these disc replacements appear to give us about 7 degrees of motion. So, which is true for a knee replacement as well. You don't typically get normal mobility with a knee replacement than you would of a native knee. So, you have pretty good motion, yeah.
But you're doing it to relieve pain typically?
Yeah, you wouldn't do the operation unless somebody had a pinched nerve and you wanted to go in there and unpinch it. And then you have 2 options. The traditional option, which is what 99+% of surgeons would do in the country today, is fuse that level where you put a spacer or a cage with some plate and screws and you get those 2 bones on either side of the disc to grow together. Or you can do the disc replacement. Those are your 2 choices.
So I've got a couple questions. So I always thought that things went through your spine. So I don't understand how you're removing a disc. How does that,
all the good stuff travels right behind the disc. So all the nerves and spinal cord and some on the side as well. We have some pretty important arteries and veins and stuff on the side that we wouldn't want to get into that are a few millimeters away from where we're working. But the disc itself, there's nothing of any major importance in the disc space per se.
And is that true all the way down the spine?
Yeah.
Yeah.
Yep. In fact, sometimes this gets a little too complicated, but we can take a whole bone out. There's a bone and a disc and a bone and a disc and a bone and a disc. They stack on top of each other. That's how our spine works.
Yeah.
We can take a bone out of the neck or even the back, and that's called a corpectomy. And you can remove the central portion of the bone as well.
And so the disc that you're replacing is pinching the nerve.
Correct. It's usually disc and sometimes bone spurs. We call those osteophytes. Again, very similar to the knee or the hip, but we get bone spurs that are pinching the nerve. So once the disc comes out, we then remove all those bone spurs and shave all that down and get everything all cleaned up before we either fuse or put the new disc replacement in there.
So I guess I can understand why a replacement would help, but why does the fusing help relieve the pinching?
Well, relieving the pinching is done before we start the fusion. We're going to go back and unpinch all the nerves, but the pathway to get there, often, you can come from the back as well, but let's leave that for later, or maybe not even discuss that. But at this point, we're talking about coming from the front. The most common way to get there is from the front, and the pathway to get to those nerves, the easiest way to unpinch them is to take the disc out to get to them. So the disc is the doorway to our ability to unpinch the nerve. So we take the disc out, we unpinch the nerves that are being pinched by the disc and by bone spurs. Now we've unpinched the nerves. The arm is going to feel better. We're done.
Wow.
Back in the, I think 50s or so, 1950s, they would just close the patient up and be done with it, but they never stuck anything in there.
Really?
And what we learned, this was in our infancy of figuring this out. And we learned, well, that's probably not a good idea because the disc space collapses and the neck falls into a funny position. And, you gotta learn some way in medicine by trying things. And then people said, well, gosh, if that happens, maybe we should shove something in there to keep that from happening. So they used to take a piece of somebody's hip bone. Remember people talk about having their hip bone. So now technology has advanced where we actually use 3D printed cages that we stick in there and fill them with bone grafts. So it's like, technology just keeps advancing, but you got to put something in that space. And then this disc replacement technology probably came along around 20 years ago, but really didn't become good enough to use regularly until about 10 years ago. And now where the technology is getting better and better, where it's becoming a little bit more common.
Wow. Can this replacement be done throughout the entire length of the spine?
No, we find that the cervical spine works best. There's no indication for the thoracic spine because there's not a lot of motion at that level, not as much motion at that level like we talked about earlier because of the ribs. It's been done many times from the lumbar spine. I've never done it because the outcomes are poor. And less people are doing it now. In fact, I don't know of anybody doing lumbar disc replacements because we haven't gotten good enough at figuring that one out because there's so much force on the lumbar spine. Your entire body weight, or maybe not your entire body weight, but a good portion of your body weight is going down across your lumbar spine. So they fail quickly. They don't last. And so that is not being done at this point.
Yeah. So what is it? More of that fusion process?
Yeah, exactly. And from the lumbar spine, we do the fusion process. It's a little bit different because actually it's similar. From the lumbar spine, we can come in from the front and take the disc out and fuse, or we can come in from the back and fuse and take the disc out. You can't take the disc out in the neck from the back. You can only do that from the lumbar spine for anatomic reasons. The spinal cord gets in our way up top here, but there is no spinal cord down low. So we can kind of push things out of the way a little bit easier.
Wow, this is awesome. So can you see a pinched nerve? Like when you get in there, are you like, oh yeah, that's definitely pinched?
Yeah, you do. You can see the nerve is pinched. Once you unpinch it, the nerve almost looks like, when you banged your finger with a hammer. It's like red, inflamed, and swollen. It looks angry because it's been pinched. So you unpinch it and sometimes we'll even say, that's what the nerve is saying right now to us. And people often have immediate relief, meaning they wake up from their surgery in recovery room, and I'll go see them when they've been awake for 15 minutes. And they're like, thank you so much. My arm feels so much better, or my leg pain is gone. But why does my throat hurt? Or why does my back hurt? I'll say, well, because I just cut it open. That's why it hurts. But, that's going to heal, but but they're very, very immediately happy in a lot of situations.
Wow.
I mean, imagine if you had a big rock resting on your leg. I mean, wouldn't it feel nice if somebody lifted the rock off your leg?
Or like
So,
a thorn,
yeah,
you
that
know?
too, right? Exactly.
Yeah, you're like, my gosh.
Yeah, exactly.
um, so do you feel that sometimes people are misdiagnosed until they come to you? They're like, well, you know, I've got this leg pain and my doctors told me this and that. And you're like, no, man, you got a pinched nerve. I mean, do you see that a lot or?
Yeah, and I don't mean that in a bad way.
Right.
But sometimes both ways. Sometimes people will get sent to me because they have pain shooting down their groin and their thigh, and there's concern they have a pinched nerve in their back, and wouldn't you know it, they have hip arthritis and they need their hip replaced. Sometimes
Really?
patients are, because hip arthritis gives you leg pain as well, right? And sometimes they're sent to me because they have shoulder pain and pain going down their arm, and it kind of aches in their shoulder and arm, and they think they have a pinched nerve in their neck, but they actually have a rotator cuff tear or arthritis in their shoulder, and they need to have that. And then the opposite happens. Sometimes they've been treated for a long time for their, their arm or their leg, and then we find out, oh my gosh, it was actually a pinched nerve. And that doesn't mean that anybody's done anything wrong. It's just, it's an investigatory process. As physicians, we need to start ruling things in or out, and eventually we come to the right conclusion.
Yeah. I have a friend who's older, and he's been going through this whole thing, like he's got leg pain, and I think when you're in pain, sometimes you're like, I can't see another doctor. I can't do this anymore. I just want this to go away. And, they kind of lead to depression and because of the pain. And is that something that you see fairly commonly? I mean, that kind of experience?
Yeah, there's no doubt. Chronic pain has been clinically proven in studies to cause actual changes in your brain waves and cause depression. We know that chronic pain causes psychological problems. And it's not just because people say, I can't take this pain anymore, it's driving me nuts. It literally changes the physiology of your brain if you have chronic pain. So you become clinically depressed and have clinical psychological problems. So we've shown that with a variety of different neurologic studies. So yes, the answer to your question is yes, that's a real thing.
Yeah.
And we, as as spine surgeons, discuss this with patients, and we jokingly but somewhat seriously, we tell them we need to figure out, are you like nuts now because you've had chronic pain, or were you nuts before the pain? And this is, what I mean, like which was it, and how are we gonna, and it's always kind of a joke, but but you know what I'm saying. So, but there's some that.
Yeah, I mean, this is obviously just a personal anecdotal situation, but like, I don't know, like this friend of mine that has this, he's just like, I'm done with doctors. It's not working. The pain's not going away. And I don't know how to, like, should I, encourage him to go see a guy like you? He's like, I don't want surgery. So that's another thing. Like, he's mid to late 70s. He's like, I don't want surgery. Is that too late for surgery?
No. I mean, I don't base surgery on someone's age. I base it upon their physiologic age, not their number.
Okay.
I don't care about the number. You could be 85 and be super healthy, and surgery would be perfect for you, or you could be, 50 and way too sick to have surgery. So the number doesn't matter. To answer your other question real quickly, yes, a guy like me, and I'm not just touting me, but a guy like me would be a good place for someone like your friend or people like your friend to start, because I'm an orthopedic surgeon. I've done hip replacements before. I've done rotator cuff surgeries before. I've done knee replacements before. So my ability to evaluate somebody and figure out, hey, is this your hip, or is it your back, or is this your neck, or is it your shoulder, is right up my my alley. It's what I do.
Yeah.
Because I have treated all those body parts before. So I think it's worthwhile for someone to at least be evaluated.
Yeah.
And then to springboard off your other question is, well, I don't want surgery. Well, nobody wants surgery. And the good news is we specialize in not operating on people. I'm a surgeon, but my ultimate goal is to fix people without surgery. And the vast majority of people that come see us are cured and fixed without surgery.
Wow. Well, this is cool because I think, if you approve this talk, I'm going to put this video up and I'm going to send it to him. And I'm going to say, hey, man, just watch this. See what you think, because this is a soft way to get introduced to a person like you. You'd be like, well, yeah, all right, I guess maybe. So yeah, do you find a lot of apprehension? People nervous to see you, like, oh, he's just gonna want to cut me open, and do you get that?
Yeah, yeah. I mean, I think people are sometimes nervous to see any doctor. I have a white coat on. White coat syndrome is a real thing, but certainly when they come see a spine surgeon, some people will walk in. The first thing out of their mouth is, "I'm never having surgery. Just so you know," and I'm like, okay, fine. I never said you needed it. I'm just here to help, so, and we're on the same page. I don't want to do surgery on you anyway. I mean, I'd rather fix you without surgery. So yeah,
Wow.
there is some of that.
What? Well, tell me that. Like, what are some things that you do that are not surgical?
So a variety of things. I can list the basic things in America are physical therapy, chiropractic, acupuncture, and then pain management, which is, we send you to pain doctors where they can give you shots and burn nerves and that sort of thing. I even take that one step further. I take more of a holistic approach with my patients. Personally, me and my family, we're very much into as much of a healthy lifestyle as possible. So I have discussions with my patients about their diet, nutrition, anti-inflammatory diets. We talk about sleep. We talk about smoking cessation. We talk about exercise. We talk about having a mindfulness type practice in their life. These are things that are good for everybody all the time, but particularly patients that have chronic pain and have problems that can't be fixed with surgery.
I was a little apprehensive to bring these, I thought would be taboo topics up, but you started it. So you mentioned chiropractic and acupuncture. Do you have a feeling about those topics?
Yeah, absolutely. So, I mean, look, my goal is to help patients. Yeah. And I would be doing my patients a disservice if I walked in the door with my ego and took my ego and plopped it on the table in front of me and said, "I'm the master spine surgeon. And if it can't be fixed by spine surgery, then everybody else is too dumb and incompetent to fix patients." Well, that's just ridiculous. Everybody has their own strengths and ability to contribute to helping people feel better. And chiropractors and acupuncturists and physical therapists and holistic medicine doctors all have their own roles. And if they make somebody feel better, well, great for them. Good for them. That's all we ultimately want, right? Yeah. And we don't have to know why. Sometimes we can't explain why it works, but if it works, who's to question it? So I'm open-minded to pretty much anything that will help my patients.
Man, that's awesome. So if you could have designed a spine, is this design perfect, or would you have been like, well, I'd like to, on version 2, I'd like to see a spine look like this?
Oh my gosh, you're going to get me in trouble with that question, because you're essentially implying in this question that I'm a surgeon and I think I'm God, and I'm not going. I'm not getting trapped by that.
No, I think it's just more of like, in the suggestion box of God, dear okay. God, as you're thinking about this, maybe next time you could do this.
Thanks for the clarification.
Yes, so just a suggestion box.
Yeah, I mean, I think the biggest problem, from what we understand, is that if we just kept walking on all fours, we probably would be better off with regards to our spines, because there's a lot less force on them when you're horizontal as opposed to upright. Other than that, I think it's an amazing design. Maybe a little bit more room for the nerves to travel in, because mostly what we're fixing is pinched nerves, maybe discs that are a little bit more robust, that don't herniate. I don't know how you do that, but they still allow for flexibility and cushioning, but they don't herniate and allow the nerves to be pinched. And then, some magical spine that preserved mobility but didn't have instability, because sometimes spines become unstable and we have to fuse them because they're shifting into the wrong position. I don't know how you would do that, but if you want to know what we fix pinched nerves and unstable spines. So if you can have the nerves not be pinched as much and not be as unstable, that would be awesome. But I'll tell you, I marvel at the design every time I'm in there operating on somebody. It's amazing.
The whole thing, the whole human body, right? I mean, just from top to bottom, the brain, and everything.
And what we forget sometimes is, especially because we're allopathic physicians.
What does that mean?
We're MDs trained in America.
Oh.
And the reason, what we forget is that we're trained in, let me back up. We're trained in medical school to learn about the different organ systems. So, I'm an orthopedic spine surgeon. I'm the spine expert, but there's a heart expert, there's a liver expert, there's a kidney expert, there's a skin expert, and there's a brain expert, and the list goes on and on, right? But what we forget is that we're not a bunch of organs. We're one organism. And it's all interconnected. And it's so amazingly designed. Not only does each organ do such just mind-boggling things, if you really think of what these different organs do, but they do it in concert with each other, and they're all talking and knowing what the other organ is doing. And it's not just like they're living in their own little islands. It's one big thing that is just crazy. If you think about it, we live for 60, 70, 80, 90 plus years. Like, come on. And some people with severe illness and they still live, like it's that robust that they're still alive, even though they have all these things going on. Yeah, I agree. It's just blows my mind every time I think about it.
Yeah. I mean, I think of that from the universe perspective, how perfect the universe is, down to the smallest things. And I mean, does it make you think, this can't be random? This has to be intelligent.
I don't have an answer for that. I go back and forth, but it makes me think that however it happened, it's sure way beyond my ability. I can't comprehend it.
I love thinking about that stuff. Yeah,
me too.
You can't possibly know, but hey, you're a really cool guy.
Oh, you as well.
Thank you, doctor. Thank you. I've loved this. I hope you come back. We can talk more. When there's new technology, I need to know about robotics in the spine. I need to know all kinds of genetic stuff.
Let's do a phase 2. We can talk about minimally invasive surgery. We can talk about robotics. We can talk about some newer technologies that we use all the time now. Sure.
Brilliant. All right. Dr. Berkowitz, thank you so much for being here.
Thanks for having me. I really appreciate the time. Have a nice day.